I mean, the Royal College of Physicians has come out and said that vaping is unlikely to exceed 5% of the risk of smoking and is likely to be substantially less risky than that. So that's the scientists at the Royal College of Physicians in London. And the reason they say that is that vaping doesn't involve the processes of combustion. There's no tobacco leaf that's set fire to, and therefore there's no products of combustion. And we know that most of the harm in smoking is done by products of combustion. Those products either aren't present or they're present at concentrations 100 to 1,000 times lower than smoking. So therefore they've concluded that it's a safe estimate that at least 95% less risky. The science that we have on the comparative toxicology of vapor aerosol, the thing that you inhale from e-cigarettes, compared to cigarette smoke is very robust. It's all done by independents. It's uncontrovertible. It's published in peer-reviewed journals, and it's very high-quality work. So in terms of the difference between what's in cigarette smoke and what's in e-cigarette aerosol, we know a great deal. The area where there's more uncertainty is how that translates into long-term health effects. But the assumption is, and it's a reasonable assumption, that if there's very, very much lower levels of toxins and key toxins are simply not present, then the e-cig aerosol is going to do you much less harm. Well, the reason that we put tough regulation on smoking is that it kills, it kills 1 in 2 of its users and potentially will kill 1 billion people worldwide in the 21st century. So that's something you want to be pretty tough with. But if you've got a product that is an alternative to smoking and is very, very much less risky, even if it's not totally safe, you need to be careful about going in too hard on it, because the danger is you put in tough regulation, it makes these products less competitive, less attractive, more expensive, less diverse, and therefore people who are smokers who would consider using them become less likely to use them. The result is you get more smoking than you otherwise would have had, and your regulation has the effect, if not the intent, of protecting the cigarette trade. So the whole area is beset by the dangers of unintended consequences, and anyone regulating e-cigarettes needs to have that at front of mind. Well, I'm concerned about over-regulation of e-cigarettes, not because I'm in the industry, but because I'm concerned about public health. And what we've got here is a new low-risk disruptive technology which, if we're careless with regulation, we could kill it off or make it less attractive as an alternative to smoking. Whereas all those people who are committed to smoking, we want them to actually switch. And the products have to be affordable and attractive for them to do that, and regulation could stop that. So I'm interested in over-regulation from a public health point of view, not from a business point of view.